Go.
Hi, it's Dr. Preston, and I'm here to talk to you guys today about canine distemper virus. It's a virus that we are seeing quite a bit here in Sebastian County due to the outbreak, and I just want to go over some of the clinical signs and some of the things to be concerned about, or to call your veterinarian about if you think your dog might have been exposed. Some of the clinical signs, some of the symptoms that you're going to see. One is everything that can touch the air is exposed, is your pets can show symptoms of, such as oftentimes the first thing we see, or the first thing that the owners see, we get gooey eyes, and there'll be a pus-type drainage out of the nose, both nostrils. It's not a typical eye discharge or nose discharge we see with many other respiratory infections. It's pretty unique. The next stage of the virus is the intestinal stomach type of problems. We'll have a dog with the eyes and the nose and the heavy breathing that then will start developing vomiting and diarrhea. They also will have a pretty significant fever, and the fever may come and go. It doesn't stay up, it comes and goes. If they survive to this stage, they can clinically go into the neurologic syndrome of the disease, and that's where they can have seizures. They can have everything from just a grand mal seizure to little, what we call chewing gum fits, which are almost, it's kind of the classic distemper. The chewing gum fits will be where you see their muscles in their head will just go up and down. If you've got short hair on your dog, you can actually see them pulse up here and in their jaw, and that can almost be, along with the other symptoms, it's a very frightening diagnosis. If your dog has distemper and is diagnosed with it, it's all a question of immunity. People think it's 100% fatal. It's not. I have some patients of mine that have come in for 5, 6, 7, 10 years after they have survived distemper virus. So it's not always a death sentence. Most of the time, I mean, I'm not gonna lie, most of the time it is a death sentence, but not always. The diagnosis for it is pretty difficult and expensive. So most of the time, most people just go on the symptoms. You bring your pet to the veterinarian. We ask the questions as far as what's the vaccine history of your pet, and then we also follow up with the exam. Then if there's any question and you want it answered, we can run a PCR test, send that off to the lab, things like that. Cerebrospinal fluid tap is a good way to do it too. But most people don't go for that. They want to know that day. The treatment for it. Basically, once again, it all boils down to your dog's immune system. If they can fight it off at the respiratory stage, they may never have a neurologic problem with it. Sometimes they'll have a stained enamel to the teeth, so they'll have a brownish colored teeth. Sometimes they'll have a hardened, dry, thickened nose and pads of their feet from this. And then at that point they may start with neuro symptoms and signs. They're contagious though. They're contagious for a long time. They're contagious up to 2 months after fighting it off. So respiratory symptoms come, say they go, your dog can still pass it to another dog for 2 months following that. So that's rather frightening. The best way for your pet not to get distemper is to vaccinate. Vaccinate, vaccinate, vaccinate. This disease has been around since the 50s, probably longer. That's 1950s. And there's been a vaccine for that long too. It's a very good vaccine. This disease is related to measles in humans, although we cannot catch distemper. So this disease is well known. But the vaccine needs to be given several times between the ages of 6 weeks to 16 weeks, several times, and then boosted again after a year of age, and then depending on the vaccine you use, every 1 to 3 years to follow that. if your pet has ever had distemper, your pet really doesn't need the distemper vaccine, but it's very hard to get the vaccine for the other diseases without distemper in it. But prevention is by far the best way to go. And that's really all I have to say. Oh, one more thing concerning other exotics and wild animals. The ferret can get distemper virus. The fox can get distemper. The raccoon can get distemper. The coyote, the wolf, the mink, the otter, the badger, the wolverine. These are all animals that can also get and die with distemper. And honestly, we see it very frequently in raccoons and foxes around here. Thank you very much.